All right, everybody, welcome. My clock's showing just turning 12 o'clock. So welcome to Parkinson's and Your Pharmacists, our webinar presentation today. My name is Mark Womack. I'm the Community Development Coordinator in the Grey Bruce area. I'm very happy to be with you today. And also very happy to introduce our speaker, who I've gotten to know a little bit over email and just chatting before the presentation. So I would like to introduce and welcome Alison Theriault, who I have gotten to know and understand is a second-generation pharmacist. Her mother is also a pharmacist, which is wonderful. And before I get into her bio and introduce Alison, on behalf of all of us, Alison, I would like to especially thank you. I know you are on the front lines. You are doing your best and under unusual circumstances to make sure everyone in your community is safe and has their medications and is self-isolating to the best of the ability. So on behalf of all of us, you know, our biggest thanks to you for being on the front line and putting yourself out there and doing that.
Well, thank you very much. That's very kind.
In terms of who you are, I'm going to read from your bio because it's fascinating. You've told us you're a pharmacist who practices with Rollston's in Norfolk County. You graduated from Laurier with a degree in biology and then attended the University of Waterloo's pharmacy school to pursue your education, graduating in 2014. In 2018, and this is an incredible accomplishment, you completed your Doctor of Pharmacy degree, also at Waterloo. It says you love your role as a pharmacist in the community, providing personalized clinical service to the residents of Port Dover and Simcoe, both beautiful communities, through one-on-one medication reviews in-store and at people's homes, developing specialty compounding products, and providing long-term care pharmacy services. In addition to that, because that's not enough, you're also an adjunct clinical assistant professor at the University of Waterloo School of Pharmacy, where you train the next generation of pharmacists, which is absolutely amazing. So please welcome Alison Theriault, and just bear with us for a moment as we change over to her presentation.
Wonderful. Thank you so much for the kind introduction, Mark. I really appreciate it. And yes, when you list it all off like that, it really does seem like there's a lot of things on the go, and that certainly is true. But I wouldn't change it for the world. I really do love my job, and I was so thrilled to be asked to join you guys in part of this presentation. I also wanted to thank the Parkinson Society, one, for the invitation, but two, for the flexibility in shifting this from an in-person day that would have been fantastic to a really flexible online system. So I'm so thankful that a number of people have joined us and we're still able to do this even though we're not able to be together in person. So without further ado, I will go ahead and get started. Like Mark mentioned, I'm very open to any questions, and I have left a bit of time at the end for questions. And so we can regroup then, but feel free to use the question box or the chat function as we go, and we'll go from there. Okay, so when I was asked to do this presentation, there were a number of different potential sort of topic options, and I thought the best way for me to sort of talk about my role as a pharmacist would be to give you some food for thought of ways that your pharmacist can help you in living with Parkinson's disease. And I have a couple of disclosures in regards to that. So the first is that this presentation obviously is not meant to be medical advice. And so if you have very specific questions about your own care or your conditions, please make sure you consult your own pharmacist and your physician. I do have a few examples in there, and I'm happy to answer questions, but you know, I'm not, everybody here is pharmacist, so I want to make sure I'm not giving advice that's not sort of tailored to your specific case. And I'm also employed by Rollston's Pharmacy, which is an independent pharmacy group in Norfolk County. And so a lot of the examples that I'm giving are things that I see in my own practice. And so what you see in your own pharmacy, in your own community, may differ slightly. And that's okay. I'm just giving some examples of things that, that I have seen or that I have done in my practice. And And you can kind of take that as ideas and then go out into your own communities from there and find pharmacists that can help you in their own ways. So what are we going to talk about today? I thought I'd start with a bit of an outline. First, I'm going to talk a little bit about the circle of care, and for you as someone who is either living with Parkinson's disease or as a family member or a caregiver of someone with Parkinson's disease, who else is going to be in that circle and who else is on your team. I'm going to give a bit of an example of what most people think pharmacists do and some insight into what actually happens behind the counter of a pharmacy. And then I'm going to go into what I hope is the most interesting part of the presentation for you, which is what else your pharmacist does that you may not know about, or what else your pharmacist can do for you. And then, like I said, at the end, we'll have some questions. Okay, so the circle of care. So this is a term that we use a lot in the medical world. And the general idea of the circle of care is that you as the person, or the patient for lack of a better term, you as the person are at the center of your own circle of care. And then everybody who supports you in your journey in living with a disease, whether it's Parkinson's disease or any other condition that you might have, everyone else who's supporting that care is in the circle of care. And so we talk about that in terms of sharing information, for example. So most people would likely be aware that when you go to your neurologist, they send notes to your family physician. And that person is always sort of in that circle and aware of what is going on, even with other people that are on that care team. Or if you have home care workers that are coming in and helping in the home, sometimes they will communicate back with other members of that circle. So there's this network of people that are there to support you. Plus there's other people that are on your team that may not always be privy to the ins and outs of every detail, but are there on your team and as part of your sort of roster of people that can help you. So that includes your family, your caregivers, your nurses or nurse practitioners, social workers even, or PSWs that may come into the home and provide support, spiritual care, physical therapists and occupational therapists, which are hugely helpful for people living with Parkinson's disease, speech language pathologists, dietitians, even support groups and advocacy groups like the Parkinson Society. So there's a lot of different people that are sort of those touch points for you. But last but not least, pharmacists are definitely a member of your team and part of that circle of care. And so you may sometimes have conversations with your pharmacist that make you think, well, they don't know what the neurologist did, or they don't know what my family physician did. And that's absolutely true. We are not sort of automatically looped into a lot of that communication that happens. So we often rely on you as the patient to help fill in some of the story. So we'll often ask you, well, what did your doctor tell you about this medication? Or what did your neurologist say about that issue that you're having? And we're not always automatically looped in, but we are certainly still part of the circle and able to help you make some decisions with your care. So I did a quick Google search to try and identify, what do pharmacists do? Like, what does the average person think a pharmacist can do? So I Googled pharmacist, and it brought up many different images of medicine. So as you can see in the top picture there, counting pills onto a counting tray. That's a very, very common portrayal of pharmacy. There's another photo of a pharmacist giving advice and holding up a medication vial, so likely telling this person about their medication and giving some counseling there. And then in the bottom picture, we have a pharmacist who's helping some young children, and I think their mother, who's just not in the picture, but helping them to pick up some medicine over the counter that would be safe for them. And so these are what we commonly think of when we think of pharmacists. But there's a lot more to it. So I wanted to give you a little bit of insight into what actually happens behind the counter of a pharmacy. So everybody is likely familiar with their pharmacy as a place that they go to get their medications and a place that they go to maybe get some advice as well. And so I wanted to give you just a background of what actually is going on behind that pharmacy counter, that when you give in a prescription, what happens to it? So what is the life of that prescription? So in most pharmacies, there are a number of different people on the team. It's not just a pharmacist. We heavily rely on many other professionals to help us provide our services. And the biggest part of that in most dispensaries is a pharmacy assistant or multiple pharmacy assistants and pharmacy technicians. And so there's a bit of a difference between those two roles, which I will go into a little bit. But these are the real sort of people who do most of the daily tasks of the pharmacy. So processing prescriptions in the computer software, for example. So when you hand in a prescription, they find you in the computer, input the prescription onto your file, and that means choosing the correct drug, whether it's tablets or liquid or whatever type of drug the doctor has prescribed, choosing the right strength, writing out the directions, figuring out the quantity, how many pills you actually need, and identifying who the prescriber is, which can be easier said than done, depending on how messy their writing is. Many doctors and nurse practitioners are moving towards electronic prescriptions, which has helped so much, but we still have a few that have that messy handwriting, which I'm sure everyone's familiar with. And then during this step is also when we adjudicate to a drug plan. So that means we transmit the claim to a drug plan automatically through the computer, and then they spit back at us essentially how much you would owe to pay for your prescription. So it could be nothing, it could be more, it could be less, depending on what type of drug plan you have, or if you do not have a drug plan at this point. Unfortunately, that part often takes a lot of troubleshooting. Sometimes we need to phone the drug plan to sort out different issues. It takes a lot more than you would think to figure out how much you should pay for your prescription. So sometimes that step can take quite a long time. Once all of that is done, then the prescription's actually filled. So that means going to the shelf, selecting the correct product, counting out the tablets, weighing out the quantity of cream, for example, that it might be, mixing things. So, if you're getting a liquid antibiotic, you have to add water and mix it up, and repackaging those prescriptions. So essentially taking them from a big bottle, putting them into a little bottle, and making sure they are labeled all correctly. And then all throughout the day as well, there's a lot of inventory management and customer service that happens. And this is in your sort of typical community pharmacy. So then what happens after that? This is where the pharmacy technician or the pharmacist come in. So a pharmacy technician can do everything that a pharmacy assistant can do. So everything I was just talking about with processing prescriptions, filling them, managing inventory, answering phones, all that sort of thing. However, the pharmacy technician also can have the added responsibility of doing what we call a technical check of each prescription. So that means that they check the prescription to make sure that basically everything that has been done so far is correct. So did they choose the right person? Has this prescription been filled for the right person? Is it under the right doctor? Is the dose correct? Is the drug in the bottle exactly what we say it is? Are there enough tablets in the bottle? All of those sort of things are checked by a pharmacy technician. And they also check that the drug plan billing has been done correctly. And a pharmacy technician can also do a bit of preliminary screening for therapeutic issues. So those are things like allergies or drug interactions. Largely that responsibility falls on the pharmacist, but pharmacy technicians also play a role in some of that preliminary screening before it gets passed to the pharmacist. And so in some pharmacies, there is no pharmacy technician to do this step specifically. So sometimes it's done by the pharmacist themselves, but depending on the setup of the pharmacy, you may see both people checking a prescription. The last step is where the pharmacist does their therapeutic check of the prescription. So, up until this point, it's ready to go. The label is on it, the right drug is in the right bottle, everything looks fine, but the pharmacist is responsible for making sure that this drug is appropriate for you. And they assess this every single time you fill that prescription. So it happens the first time you get a drug, but it also happens every time you get that drug refilled. So we do the same steps every single time, recognizing that things can change over time, and we have to make sure every drug is safe for every person before it gets to them. So this is where we sometimes identify what we know as drug therapy problems. So that's essentially any sort of issue that could come up with your medications that either makes it not safe for you or might make it not work well enough for you. So for example, drug interactions are a big one that we're always looking for. So rest assured, if you're getting a new medication, the pharmacist is always screening your other medications to make sure they're not going to interact in a way that's not appropriate. We check for allergies to make sure you're not going to have any reactions to what we've prescribed or what we are dispensing, pardon me. We check the dosing. So that means, for example, does the dose seem too low? Does the dose seem too high? And there's a number of different factors that can impact this. So, for example, people who have poor kidney function, sometimes that can really impact the response that you have to certain drugs. And so we see this a lot as folks get older, where your kidney function just starts to decline a little bit, and all of a sudden your drugs are going to be working differently in your body. And so we can identify whether a dose may be now too high for you and whether we need to back off on the dose a little bit because you're not able to get rid of that drug as much as you were before. So that's just one example. We also look at, sometimes we'll ask for how much you weigh because some drugs are based on your weight. And so we can decide whether things seem appropriate or not, and then take it from there if we need to do something about it. So if it seems like it's maybe slightly too high or slightly too low, we can take it a few different ways to manage that issue. Most often that involves contacting the prescriber and making a recommendation to adjust it. But I'll talk a little bit about that a little later on as well. So when we're looking at every medication, we're always looking and screening to say, is it indicated? So does that means, is this actually going to treat or manage whatever we're expecting it to treat? So for example, if someone is having allergies and they're given an antibiotic, I know that that antibiotic is not indicated or not appropriate for that condition because antibiotics do nothing to help with allergies. So that's just one example. But every prescription, we're always making sure that it matches what we think you're going to be treating. Is it going to be effective for you? So is it actually going to work? Again, that's going back to the dose. And is it going to be the right amount of drug for you? Does it make sense that you would take a drug once or twice or 3 times a day? Or should it be more? Should it be less? So we can judge those sorts of things by looking at your prescriptions. And then last but not least, is it safe for you? And this is where we, again, look at those drug interactions, allergies, what the potential side effects could be, and help you manage those should they come up. So all of this is assessed every single time you fill your prescriptions, and that is really where your relationship with your pharmacist can help play a big role, because it can help prevent some of these problems ahead of time, or it can help us be on the lookout for certain things as we go along. And so that's the general sort of basics of the life of a prescription when you hand it in at the pharmacy, what each person is responsible for. And so that doesn't seem too bad, right? It seems like, okay, that should take about maybe 10 minutes, but depending on the pharmacy, sometimes they'll say, you're going to have to come back in a few hours, or, we're very busy right now, so it's going to take about an hour or so. Again, depends on the environment that you're in and what else is going on that day. But I think the key thing is to remember that, it doesn't take long to count medications and put them from one bottle into another, but it definitely is a very careful process, and we have to make sure we're doing our due diligence to do it safely and in a way that makes sure whatever you are getting from us is going to be safe for you. And so sometimes that's why it takes a little bit longer. Perhaps there's a lot of other people that are in the same boat, our workload is just very high, and so sometimes it can take a little bit longer, and that's why it may seem like a straightforward process, but it's not always as easy as it seems. The other part of it is that the pharmacist is often not just checking prescriptions. There's so many other things that happen in the day-to-day flow of a regular community pharmacy. And so that's what I wanted to touch on here as well. The other things that your pharmacist can do for you besides just checking your prescriptions and making sure they're safe. So one of the biggest parts of our job is giving advice. And that's actually why I think I was drawn to being a pharmacist in the first place. I remember when I was younger thinking I thought I wanted to be a teacher. And I realized that pharmacists are teachers. We have a lot of information to share, and we're very accessible and able to give that information to people, without any issues. So it's a really neat blend of being able to work in the science and healthcare field, but also be able to teach people. And so a big part of our job is just that. When you get a new prescription, a new drug that you've never had before, usually your pharmacist will talk to you about it. And so everything you ever wanted to know about that medication, that's your time to ask it. So we often are giving information about what a medication is for and how it works, possible side effects that you could experience, and what to do about them. So, for example, this may upset your stomach, but if you take it with food, that can help prevent it. So we can give you some ways to prevent some of those side effects, or if you do end up having side effects, we can help you manage them. We can tell you what the expected benefit of your medication is. So what is it going to do for you, and how long should it take to feel those benefits? And then we can always give you some tips for making it easier to take. So for example, when you can take it, can you take it with your other medications? Does it have to be on its own? How do you use it? Demonstrating, how to use different devices like nose sprays or puffers, that sort of thing. We always want to make sure you know exactly what you're walking out the door with and that you're confident in using it. Another big piece of advice that we give is for over-the-counter questions. So that would be not related to prescription products, but if you go into the pharmacy and are asking, I have a stuffy nose, what should I do about it? Or I think I have athlete's foot, what should I do about it? We call those common ailments. So those are ailments that are relatively common and easy to identify and treat. And we can do an assessment to make sure we're treating them appropriately. We answer a lot of phone calls, I can tell you that, both from our patients, so our customers who are asking questions about their medications, but also from other healthcare professionals. So physicians or nurses or specialists may call the pharmacist to get some advice or some guidance on what medication might be most appropriate for this person, or do you have this medication in stock and how do I get it to be covered for this particular person? So we can help work with other healthcare professionals and give them some suggestions as well. Like I mentioned, pharmacists are very accessible, and we are well known as what a lot of people think are the most accessible healthcare provider. You can walk into a pharmacy and the pharmacist is always there, and you can ask them advice late in the evening, on weekends. Often you don't need an appointment to do so. So that accessibility is something that's really helped people to feel like they can really trust their pharmacist and be able to go there for advice very easily. And we also have the skills to be able to relieve some of the burden on our healthcare system. So like I was saying, many common ailments can be managed by your pharmacist. So we can do an assessment of you and what symptoms you're experiencing, how long has that been going on, what have you tried so far, all that sort of thing. And based on the story that you tell us or based on your symptoms, we can decide whether it's appropriate for us to treat it. So can we recommend something over the counter that you can use? Or do we think you need to go see your doctor? Or do you, knock on wood, in emergencies, actually need to go to emerge? Is this something that we really can't treat right now? It's something you need to go and get looked at right away. So we can kind of start with that triage step to be able to help people treat some self-treatable conditions, but also recognize when it's not self-treatable and you need to seek additional help. Some exciting news on the front of pharmacists in the coming months, I would say, likely in the next, by the end of 2020 or into 2021. There is a lot of talk about pharmacists getting prescribing rights for a few more additional prescription products for those common ailments. So for example, some of our prescription products that we might use for like eczema, for example, there's very few that are available over the counter. There's lots of great prescription products, and eczema is a fairly common and reasonable option for treatment. So your pharmacist may eventually be able to prescribe some of those prescription products that would help a little bit better. So keep your eyes on that. That's some exciting new developments that will be coming for pharmacists in Ontario in the next probably 1 to 2 years. This has been a long time coming, so we're very excited about it. We're not exactly sure what it will look like in all pharmacies, whether it's something that is going to be a free service or something the government will provide funding for, or what kind of paperwork would need to be filled out for those sorts of things. So all those finer details are still in the works, but we're very excited to have that potential expansion of our scope of practice to be able to help more people with those things. Okay, so those are the things that people often think about when they think of pharmacists, but what else do pharmacists do? And I bet you it's probably more than you think. So I wanted to touch on this program to let you know about it if you are not already familiar with it, or if you have already experienced this program with your pharmacist, talk about what you should expect out of these consultations. So there is an opportunity to meet one-on-one with your pharmacist for a medication consult. So in Ontario, this program is funded by the Ontario government, so it doesn't cost you, the patient, anything. It's covered by the Ontario government if you are on 3 or more medications. So if you're only taking one thing, it doesn't always qualify you. You have to be on at least 3 medications, but you can always check with your pharmacist to see if you qualify. And this is a one-on-one appointment done either with just you and the pharmacist, or if you have a family member or a caregiver that you would like to participate as well. Or in some cases, we have a family member that is available for translation purposes, those sorts of things. We can meet as a group, and this can be done either in the pharmacy or actually in the comfort of your own home. So if you are not able to get to the pharmacy, a pharmacist can come to you and do what we call an at-home meds check. This is one of my favorite parts of my job, is visiting people at their home. And again, not all pharmacies have extra pharmacists to be able to offer those services, but it's definitely worth asking. And one of my favorite times to go visit people at home is right after they come home from the hospital. So if you're in the hospital for a number of days or weeks for whatever purpose, sometimes it can be very overwhelming coming home and having a whole bunch of medicine that you had before going to the hospital, and then a whole bunch of new medicine when you come home. And how do you reconcile all of that and keep it organized and make sure you're doing everything correctly? And so those are some of the most impactful times that I visit people at home, because it really just helps to ease some of those anxieties and really help to make you feel like, I can do this, I can take charge of whatever I need to do to stay well and stay out of the hospital the next time. And so the pharmacist will come and meet with you, and you can review all of your medications. So you think of the pharmacist as the medication expert. And if I wanted to talk to the medication expert, what would I bring to that appointment? So it makes sense that it would be your prescription products, anything that you take over the counter. So that's anything that you can just pick up at a pharmacy. So things like Tylenol, Advil, Imodium, all those sorts of products. And then herbal products and vitamins as well. Those are a huge, huge part of a lot of people's medical care. And it's really important that your pharmacist knows which other products you might be taking that are not prescription, because there's definitely potential for interactions and potential dangerous situations that you could get into without having that supervision. So it's always good to include those with your conversations with your pharmacist. And the goal of these programs is to help you understand your medications, help the pharmacist identify potential problems, and most importantly, help you optimize your regimen. So I always explain, you know, I've had a few people where I go to their home or they bring their basket of medications into the pharmacy and they say, well, I take medications 20 different times in a day. And the idea that I like to try is, you know, one, are there any that we can get rid of? So is there anything we can de-prescribe that you may not need anymore? But two, if you still need all these medications and they're all still crucial for you, how can we make this as easy as possible for you? So how can we optimize it? And so I actually, Mark had sent me a question that I believe one of you had sent in. And so it's all anonymous, but I thought I would integrate it into my presentation as a bit of an example of if this person were to come to me for a medication review and say, you know, I'm taking all these medications at different times of day. I'm not sure what to do. It seems like too much for me. My goal would be to make sure you understand what they're all for and that they're all important and how we can best optimize that routine to make it as simple as possible. So like I said, this is an actual medication list from someone who had emailed in ahead of time, but I will preface it by saying I really do want you to speak with your own pharmacist. I just want to use this as an example, and I don't know your own personal circumstances, but I do think you would benefit from talking to your pharmacist about how you could best approach this. And so this person is taking a thyroid medication, levodopa carbidopa, or levocarb for short, a blood pressure medication, a medication for like a hormone inhibitor, vitamin D, and calcium supplements. And there's a question here about the calcium. So they're taking the Jameson brand calcium. I'm going to assume it's 500 milligrams. And the label says that it should be taken with the meal and it should be taken a few hours before or after taking other medications or away from any calcium-rich foods. So all of a sudden, we have a number of medications that have to be taken multiple times a day, and some have to be with food, some have to be after food. So how are we going to sort this all out? So again, as an example only, and I again encourage you to speak to your own pharmacist, what I look at is, okay, here's the name of the medication. So for example, levothyroxine, levothyroxine. What is it used for? And so that's a thyroid supplement. And then here are my notes. So my notes would be that it's best absorbed, that particular medication is best absorbed on a completely empty stomach. However, it's important to keep it consistent. So if you've always taken it on an empty stomach, perfect. Keep that up, don't change anything. But if you've always taken that thyroid medicine with your breakfast, I want you to keep doing that. You don't want to change it. You want to just do whatever you've always been doing with thyroid supplements, because your dose is based on the level of that drug in your blood. So your doctor would check your blood levels and adjust your dose based on how you're taking it. So my suggestion would be, if you've always taken it first thing in the morning, keep doing that. Or if you've always taken it with a meal, keep doing that. So that's kind of a catch-22 one. Now, everybody on this webinar is likely familiar with the term levodopa carbidopa, or levocarb, because that one is often used for Parkinson's disease. And this drug is best absorbed after meals. So about half an hour to even an hour away from meals increases the absorption of that drug. So it basically makes it work better for you. But when you're first starting out with that medication, sometimes it can cause nausea. So sometimes we recommend when you first start it, try taking it with some food, but as you get used to it, then you want to take it on an empty stomach to try and help increase the absorption in your system. So again, that's very personalized depending on the person. So I wouldn't take that as sweeping advice, but for this person who's already been taking it after meals, I would consider continuing to do that. So continue taking it on its own after meals. Now here's where it gets a little easier. So all the other medications, the blood pressure pills, the anastrozole, which is the hormone inhibitor for cancer prevention, and vitamin D, which is for bone health. Those ones are totally fine to take all at the same time with each other. So I would suggest taking all of those all together with breakfast. And then the calcium is the tricky one. The general suggestion for calcium is that you want to get as much as possible from your diet. And we always recommend taking a maximum of 1 tablet at a time, or 500 milligrams. If you take 2 or 3 tablets all at once, your body is not going to absorb it properly. So while it's important to take it on its, or one at a time, it actually can be taken with the blood pressure pills, the hormone inhibitor, and the vitamin D. So even though the label for that product says take it away from all other medications, that's where your pharmacist expertise can try and help tweak things a little bit. There are definitely some medications that interact with calcium, but those other 3 right above it, the blood pressure, bone, and vitamin D, etc., those don't interact with calcium, so you can safely take those all together. So there's no concerns about having to separate out the calcium. The only one I would want you to separate it from is the thyroid pill. So all those small little nuances are the types of things you can figure out with your pharmacist and develop a plan and a schedule that's going to work for you and help you to keep it as simple as possible and as organized as possible. Okay, another aspect of helping you get the most out of your medications is that your pharmacy can help package them up for you in a way that's going to make it as easy as possible. So this is one example. This is what we call disbill or blister packaging. So it's a little bit blurry, but you can see that it's a card where there's a morning, noon, supper, and bedtime slot, and then each row across is a day of the week. So you can separate your pills out into these 4 different times, and this is all done at the pharmacy. So a lot of people have their Sunday ritual where they take all their pills out and they set up their weekly plastic organizer or for a week or 2 at a time. And if that's working for you, great, keep it up. I encourage that, and I think it really helps to keep things organized. But if you're finding that it's getting to be too much, or you're busy and you don't have time to be able to do those sorts of things to keep it together in terms of your schedule, we can help you do that. So a lot of pharmacies offer some sort of medication packaging to be able to sort things out for you. And then you know that you're getting exactly what you need every day. I find it also really helpful if it comes to lunchtime and you think, now, did I take my morning pills? It's a good visual representation, and you can look and say, oh, yeah, that bubble is empty. That means I did take my pills. I don't have to worry about it. So it just helps during those busy times when you have a lot on the go. And if you're going out for supper, say, you can just take your supper pills with you. You don't need to worry about having to, count them all out of your bottles at home and slip them in a piece of tin foil and leave them on the restaurant table. Things like this can really help to give you some more freedom and some more flexibility with your medications, because it takes that responsibility off of you and has the pharmacy help you with it. Now, one thing that I find is very specific to folks living with Parkinson's disease is that sometimes, unfortunately, 4 times a day just isn't enough. And especially when you're taking medications that are for specific symptoms, and some of them are very short lasting. So you maybe need to take them 4 times a day, 5 times a day, sometimes even 6 or 7 times a day. And as much as we can try as your pharmacist to help minimize those times that you have to take them, sometimes that's really the only way to gain control over your symptoms. And so a part of that is the challenge of how do you keep all of that organized and straight, but not lose track throughout the day. And so another medication packaging option that I wanted to mention is this strip packaging. So this is called Easy Pack. And this is actually something that we use often in retirement homes or in long-term care homes, or in hospitals. You may see staff members pulling out these long plastic strips of pills. And each little square has the person's name and the day of the week and what time they have to take them. But we can do these as well for just people that are living at home. And so if you have to take medications more than 4 times a day and your regular sort of weekly organizers are not built for that, there may be other packages that you could ask your pharmacy about that they could help you with. And so it's an interesting way to keep it organized, and you know that the pharmacy is looking after separating everything out the right way, and you don't have to worry about keeping it all straight yourself. So it's another interesting option for people. Again, I'll preface that by saying not every pharmacy has the machines to be able to do this, but if they do, it's something that's a really unique opportunity, especially for people living with Parkinson's who sometimes have to take medications many, many times during the day. Now, specialty compounding, again, a sort of unique service that not all pharmacies provide, but worth asking about. So this is an extra service that some pharmacists specialize in, where we can develop recipes for compounds that are not otherwise available. So that means we basically create formulas or create products that are not available commercially. So they just don't exist, but we can make them exist. And we do this very, very carefully. It's very tightly regulated, and everything is done in a setup sort of like this, where everybody is wearing all of their equipment to protect themselves and make sure it's done cleanly. And it usually has to be done in a specialized lab with a fume hood and safety procedures and all that sort of specialized equipment. So this is certainly a very specialized area, but it really helps to personalize a lot of medicine. So this is something that I've recently started practicing. I just sort of took an additional course in this in the fall. So it's something I'm just starting out in, but it's so interesting and it's really fun to be able to kind of get back to that chemistry roots and really figure out what drugs work well together and develop things kind of like in the olden days of pharmacy when apothecaries were the thing and everything was made from scratch. This is kind of that same theory. And so this is really a good way to adapt dosage forms to make it better for you. So for example, like a kid's antibiotic liquid, for example, if they don't like the taste of it, we can make it into something that tastes totally different. If they like peanut butter and jelly sandwiches, we can make their medicine taste like peanut butter and jelly sandwiches. Or if your cat or your dog needs a medicine that's not available from the vet, sometimes the vet will send it to us and we can make it taste like tuna or chicken, and we can make little tablets for animals or a million other things. I was trying to think of examples that apply specifically to people living with Parkinson's, and I actually thought about a particular example where the levodopa-carbidopa combination can be made into a liquid, and the liquid usually has a quicker onset, so it starts to work faster than the tablets. Plus, it really allows for really fine-tuned dosing. So if you've ever been in a position where you feel like one tablet is too much, but half a tablet is too little, and you wish you could take 2/3 of a tablet of something, that's pretty hard to get from the regular tablets that are commercially available. But if we can make that into a liquid, that really gives you the chance to fine tune your dosing and take just a little bit more or just a little bit less to find the right balance to manage your symptoms without causing side effects. So we have a few people that have started using a liquid version, of course, under the advice of their neurologist, to try and really fine tune their medicine and make it into something that they can find that perfect balance for them. Another option is, again, for people that take many, many different drugs during a day, sometimes, depending on the ingredients, but sometimes we can take all of those powders of drugs and push them all together and make it into a single capsule that you could only have to take maybe once or twice a day. And so for people that really, really have a hard time taking many, many different pills during a day, but all of them are still necessary for their care, sometimes we can work to make those things a little bit more personalized and specialized. Okay, now communication is a key part of what we do as pharmacists. So your pharmacist is really a big link between all of your prescribers. So especially when you're living with a chronic disease like Parkinson's, you may find you have your family physician, you have a neurologist, maybe you have other specialists that are involved in your care. And sometimes what your family doctor prescribes is different than what your neurologist prescribes. And, depending on how quick that communication happens, sometimes there's a bit of a gap there. And so having all of your medications coming from one pharmacy helps to prevent errors. So if you have one pharmacy where you get everything from any doctor that prescribes it for you, you know that pharmacist is going to help reconcile all of those different changes and be able to keep it as up to date as possible. And the pharmacist can help bridge the gap between appointments as well. And so if even right now during this pandemic, if you're not able to see your family physician in person for your medication refills, the pharmacist can help communicate to the physician on your behalf, or and can help to bridge that gap a little bit. Or sometimes the pharmacist can be the one to initiate communication with a specialist and say, Joe Blow has been here and these are the issues he seems to be experiencing. I'm wondering if this may be worth a try. He's going to be seeing you next week, but here are my thoughts as the pharmacist, and what can we do to try and help make this a little bit better. Another part that I did want to touch on is, again, bridging that gap and really helping to make sure your sort of treatment is continuous, is our ability to extend and adapt prescriptions. So those are terms that we use as pharmacists that may be a little bit foreign to you, but what they are, a prescription extension is where we basically ensure that your therapy is not going to be interrupted. We never want you to have to go without your medications just because you needed to wait for a doctor's appointment, or your physician was on holidays and hadn't renewed your prescription before they left, or whatever the situation might be. So pharmacists in Ontario have it within our scope to be able to extend a prescription. So that means we assess the prescription and make sure it makes sense. It's still working well for you. You're not having any side effects. And then we assume responsibility for prescribing it. So we essentially re-prescribe it for whether it's a week or a month or 3 months, whatever it might be. There are limits on how much we can give, but we can provide that extension to make sure you get your medications, even if you're waiting for a follow-up with your specialist or with your family doctor. So we really do want to make sure you never have to go without, and it's really nice that it is now within our scope to be able to do that. Now, prescription adaptations are a little bit different. That is where we actually can change therapy to ensure it is appropriate. So we cannot substitute one drug for another. That is not currently within our scope. However, we can make some adjustments to prescriptions. So, for example, if you can't swallow tablets, we can change it to a liquid formulation without having to speak with the doctor. Or if it's for a young child and they're not able to swallow tablets, or they're really sick and they need sort of Tylenol as an example, they can't keep anything down by mouth, we can change it automatically to a suppository form, for example. And last but not least, it is within our scope to adjust dosing. Now, I would say this is probably the scope that we exercise the least, just because it is something that has to be done very carefully and in collaboration with other prescribers. But one example that I often say is, if your neurologist changed your dose of your prescription and your family physician didn't know that, and the family doctor sent us a prescription for your old dose, we could adapt that dose and change it to the correct one that your neurologist has prescribed so that it aligns with what you were already on. So that's one example. We have other opportunities to be able to adjust dosing, but that would be a very individualized discussion each time. Okay. So those are just a few of the things that I wanted to tell you about, or maybe plant the seed of some other things that you may not know your pharmacist could do for you. But I thought I would be remiss to not address your pharmacist and your pharmacy during the current COVID-19 pandemic. So rest assured, your pharmacy is still there. We are an essential service, but our services might look different than what you're used to. So your pharmacy may have reduced staffing, may have shorter hours, and we may be busier. To be honest, right now we've been busier than we have been during a regular time. And a lot of that is because at the beginning of this pandemic in mid-March, the Ministry of Health requested that we reduce everybody's medication supply to a 30-day limit. So while you may usually get 3 months of medications dispensed at one time, the ministry has asked us to cut back to only 1 month for everybody at a time, just to try and reduce the risk of drug shortages during this pandemic. Now, drug shortages have been a huge issue in Canada for at least the last 4 years. If not longer. You may have not known that, and that's because your pharmacist has done a really good job trying to prevent those shortages for you. But this is a piece of that puzzle is during this stressful time for society as a whole, we need to be very careful to not cause any shortages. And right now there are no shortages specifically related to Parkinson's medications, so I don't want you to worry that your crucial drugs are not going to be available, because we haven't seen anything like that popping up yet, and this is part of how that's being prevented. So I'd really encourage you to ask your pharmacy about whether they have a delivery option, if they're doing curbside pickup, if they can do a consultation over the phone. And I also would want to just remind you that this is a very, very challenging time for everybody, of course, and a lot of non-essential services at pharmacies have been postponed. And so that may include things like a meds check. So if you're thinking, I just kind of want to check in, I would suggest if it's not super urgent, it would be something I would try and defer until after this sort of returns to whatever our new normal might be, just because of that shorter staffing and more challenging workload management. Your pharmacy may not be in a position to offer that service currently, but it doesn't mean they don't want to or that they won't in the future. So certainly, I don't want to discourage you from reaching out to your pharmacist. We are absolutely still there, and that's why we're still there, is to be able to help you through these times. But just sort of go into it with the idea that it's going to be very different than what it was before, and hopefully we will get back to that new old accessible model of care, because that's really why we're there. We love seeing you in the pharmacy, and we hope that at some point in the very near future, things will be able to return back to the way we would like to operate. So just wanted to put that in there as a bit of a note. So just to sum up, just a reminder that your pharmacist is here to help you and support you in managing Parkinson's disease and any other conditions you might have. The nice thing about community pharmacists is that we never know what's walking through the door. It could be heart failure, Parkinson's, diabetes, cancer, it could be anything. So we need to know a little bit about everything to be able to help manage all of those same conditions. And so I think it's important to recognize that your pharmacist is truly the medication expert who can help you. They may not know all the answers right off the top of their head, but they can certainly access a lot of different resources to help support you in your care with whatever may be troubling you at that time. Regular check-ins with your pharmacist are key, making sure you know you are getting the most out of your medications, and just remember that you are the most important piece of the puzzle. So all of this revolves around you and your care, and the pharmacist is a piece of that puzzle and a piece of that care team that really helps to support you in this. So that's about it. I wanted to thank everybody for joining us, and I'm happy to take any questions if you have them.
Thank you, Allison. I'm going to take the screen back, so just bear with me for a moment. There we go. Oops. Sorry, technical issues. There we go. I did have a couple questions come up that were sent to me. The first one is, I forgot to take my medication. Should I be calling my doctor or pharmacist first?
Ooh, that's a great question. I would say your pharmacist. It would be, you're likely to get an answer sort of right away. And as I've sort of referred to, we are certainly the experts in medications, so we can easily tell you whether you should take it right away, if you should just skip a dose and wait until your next one. I would absolutely call your pharmacist first.
Wonderful, thank you. And the second question that I have that came through is, what's the biggest misconception that people have about pharmacists?
Ooh, that's a great question. I would say there's a couple. So one is, as I sort of explained in the presentation, there's a perception perhaps that all the pharmacist is responsible for is following exactly what the doctor said and giving you the pills. And as you can see, there's so much more to pharmacy care, and the pharmacist really does play a crucial role in that system to be able to safeguard you and make sure all the medications you are getting are exactly correct. It doesn't mean that your doctor always makes mistakes by any means, but we're just another member of that team that looks at your care through a different lens. So we're looking at your care through the lens of your medications, and we can see things potentially in just a different way than some other healthcare professionals might. So we can all work together to try and help keep things sort of optimized. The other misconception I think people have about pharmacists is that this is a struggle in Canadian healthcare, where we have universal healthcare, but we do not have universal pharmacare. And part of that is a struggle for people because while medicine, like the act of treating someone as a doctor or in a hospital, is a free service in Canada, the drugs that you need to treat those issues are not free. And so there's a misconception, I think, in some areas that, pharmacists are just out to make money, and that couldn't be further from the truth. It's a funny business being in community pharmacy because it is something that people need to still pay for, even though it's a form of healthcare. And so I think it's a tough balance, I find. And I think if you kind of go into it with your pharmacist always thinking we really do have your best interests at heart, that helps to blunt some of that a little bit and try to make you recognize the value of what a pharmacist can do. And while I wish I could give everybody their medicine for free every single time, that's the dream. Unfortunately, that's currently not the reality in Canada. We will see how things change in the coming years, but that's definitely a challenge.
Excellent. That's all the questions we have. Allison, I have to say, you have the best timing. We are just coming up on that hour. Wonderful presentation. I know my pharmacist is one of my best friends. I rely on them. I share with them. They take care of me. And on behalf of all of us, thank you for being part of our community, the Parkinson's community, and our general living community where we live and where we interact. So I want to thank you on behalf of everyone viewing and on behalf of Parkinson's Society Southwestern Ontario for your time today, for your expertise, and for a wonderful presentation.
Well, thank you so much again for having me. And if any people have questions that come up or come to mind after, please don't hesitate to reach out to Mark by email. And Mark, you're more than welcome to forward them on to me. I'm more than happy to answer. But I would definitely encourage people to build that trusting relationship with their own pharmacist. Find a pharmacist you trust and use them to your advantage. That's what we're there for. Thank you so much.
Excellent. Well, everyone, thank you for joining us. As indicated on the screen, if you'd like resources, information, anything about your support groups in your area, please contact us at www.parkinsonsociety.ca. Most of all, have a wonderful weekend, stay safe, and stay healthy. Thank you.